He was just playing with a puppy. A small bite, no blood, no pain. A month later, seizures, aggression, panic at the sight of water. 4 days after that, death, fully conscious, completely helpless. It was rabies. And once the symptoms appeared, there was nothing doctors could do. This virus doesn't kill right away. It hides. It waits. And when you finally realize something's wrong, it's already too late. But why can't we stop it? Why can't the brain be treated? Why doesn't the immune system fight it? And how do doctors treat it, if you act in time? Today, you'll get all the answers. Rabies is a virus that doesn't attack your lungs, your skin, or your blood. Its target is your brain. It's transmitted through the saliva of an infected animal, usually through a bite, but sometimes even a scratch or contact with a mucous membrane is enough. A bite, a lick, contact with a wound, that's all it takes. Once the virus enters the body, it behaves differently than most. It doesn't look for blood vessels. It chooses the nervous system and slowly moves toward the brain. This is a neurotropic virus. It literally loves the brain. It doesn't just cause symptoms, it rewrites the signals that control your body, your emotions, your reflexes. And that's why rabies is one of the most terrifying viruses we know, because it turns your body into a weapon and your mind into a prison. It all starts with a moment you might not even notice. A bite, a scratch, that's the entry point. The virus gets into the body, but instead of attacking right away, it hides. Its goal isn't a fast infection, it's a strategic takeover. At first, it stays in the muscle tissue. Then, it begins a slow crawl along the nerves. From the bite, up, to the spinal cord, then to the brain. This can take weeks or months. You might even forget about the bite. But the virus doesn't forget about you. This is the incubation period, and that's its greatest strength. Because once the symptoms appear, the virus is already in your brain. And that means you can't be saved. It made its way in silence, and now it's in the brain, where everything is controlled. Rabies doesn't just kill brain cells, it causes encephalitis, inflammation of the brain. It's like setting off an explosion in the control center. Signals stop working, the body turns against itself. At first, anxiety, restless sleep, a feeling that something's wrong. Then, spasms, paralysis, trouble swallowing. The person can't even swallow their own saliva. And then comes hydrophobia, the fear of water. But it's not a psychological fear, it's physical. Just seeing water causes pain. Trying to drink causes the throat to seize. The brain won't let the body swallow. Breathing, movement, coordination, it all starts to break down. The person may scream, become aggressive, hallucinate, and the worst part, they understand everything. Rabies doesn't turn off the mind right away. You're trapped inside a body that's shutting down, fully conscious, to the very end. We're used to thinking that modern medicine can fix anything. Antibiotics, antivirals, surgery, but not rabies. Because rabies isn't just a virus in the blood. By the time symptoms show, it's already in the brain. And the brain isn't something we can clean, flush, or replace. Brain cells, neurons, don't regenerate. And rabies doesn't just kill them. It rewrites how they function. Most medications can't reach the brain in strong enough doses. And the immune system, if it fights, it risks destroying the brain in the process. And no, you can't just open the skull and remove the virus. It's not localized. You can't cut it out. It's embedded in your signals, your tissue, your nervous system. Doctors once tried to fight it. In 2004, a 15-year-old girl was placed into a medically induced coma. They called it the Milwaukee Protocol, and she survived. But every time they tried it again, it failed. Dozens of patients, almost all of them died. So today, the rule is simple. Once symptoms appear, it's already too late. And if anything saves you, it's acting before they do. In 2004, a 15-year-old girl named Gina Giese became the first person in history to survive rabies after symptoms had already begun, and without a prior vaccine. Doctors tried something radical. They shut down her brain, put her into a coma, flooded her with antivirals, and waited. And somehow, she lived. She recovered. She finished school, got married, had kids. It was a miracle. And the world thought, we've cracked it. They called it the Milwaukee Protocol, and they tried it again, and it almost never worked. Dozens of attempts were made. Almost all ended in death, or survival with severe brain damage. And to this day, doctors don't know why Jana survived. Maybe the virus was weak. Maybe her immune system was uniquely strong. Maybe she was just lucky. There were a few others. Some survived with no clear reason. Supportive care, strong ventilation, maybe early intervention, but in almost every case, they were left with major neurological damage. Today, the Milwaukee Protocol is rarely used. It's not a cure, it's not a treatment, it's a last chance in the dark, and the survival rate is still near zero. Here's the truth. Rabies is 100% survivable if you act before symptoms appear. The moment you're bitten by a dog, a bat, any animal, you wash the wound. Not casually. 15 minutes with soap and running water. It won't kill the virus, but it helps reduce the amount of it. Then, you go to a hospital. Right away. Not tomorrow. Not if it gets worse. Now doctors will give you a series of injections, usually 4 to 5 doses of vaccine over 2 weeks. Sometimes they also inject rabies immunoglobulin directly into the wound to give your body an immediate defense, and that's it. If you get treated on time, you survive. Period. The problem is, most people wait. They think it was just a scratch, or the animal looked fine, and by the time they realize the danger, it's already too late. It sounds simple. If rabies spreads through animals, eliminate the carriers. No animals, no virus. But it doesn't work that way. Rabies doesn't live in just one species. It's in dogs, foxes, raccoons, skunks, cats, cows, and the most dangerous of all, bats. Bats don't just live in caves. They live in cities, attics, trees, under bridges. And their bites? You might not even feel them. Also, rabies exists on every continent except Antarctica. It's part of ecosystems, rural areas, cities. It's not one outbreak. It's everywhere. Some countries tried mass extermination. It failed. The animals came back, and the virus was still there. That's why the world chose a different strategy: vaccination. In many countries, vaccinating dogs is mandatory. In the wild, vaccines are put into food and dropped from planes for foxes, raccoons, and other wildlife. The goal isn't to kill the animals, it's to build a barrier. Because rabies isn't a single enemy, it's a network. And you don't destroy a network, you block it. A girl in India, bitten by a playful puppy. Small bite. No blood, no pain. She didn't tell anyone. A month later, she screamed at the sound of water. 3 days later, she was dead. A camper in the US. Slept in a tent. Felt something brush against his arm in the night. Thought it was a bug. 4 weeks later, hallucinations, panic, refused water. He died in the ICU. It was a bat bite that he never noticed. A child in the Philippines, bitten by a dog on the leg. The family wanted to wait. 10 days later, he couldn't breathe. He died in the hospital, terrified of drinking. These aren't old stories. They happen every year. Hundreds of thousands of... Here's the truth. Rabies is 100% preventable, but only if you act fast. If you're bitten, scratched, or even touched by the saliva of an animal, wash the wound immediately with soap and water for 15 minutes. Then go to a doctor. Not tomorrow. Not if it gets worse. Now you'll receive a series of vaccine shots. Sometimes an injection of immunoglobulin directly into the wound. It's uncomfortable, but it works. If you act before symptoms appear, you live. If you wait, you don't. Rabies is not a dramatic story. It's not rare. It's here. Now it hides. It waits. And when it strikes, no one can save you. What would you do if a stray dog bit you? Would you go to the hospital? Or would you wait, like so many others did? Share your thoughts in the comments. Maybe your story will save someone else. Subscribe to the channel if you want to know what else is hiding inside us.